There could be a lot of different things going on. You might be wondering, how in the world am I going to even notice this to begin with? Okay. So to begin, let's just start by talking about what are some normal blood sugar levels anyway, okay? So when we talk about blood sugar levels, usually the metric we try to use, or that is used in a lab value, I specifically don't use them, but that is used in a lab value, is a fasting glucose reading, okay? So this is in milligrams per deciliter of glucose or sugar actually in your bloodstream. You can get this through a finger prick. You can also get this just when your blood is drawn at the doctor's office in the morning. If you ever have to fast going into your blood work, that's usually why they want to get a fasting glucose reading. So 99 or below of this number is considered normal, and fasting is relative. Usually if you just don't eat anything after you get up in the morning, this is going to be okay for a fasting glucose reading, so you don't need to fast for like days on end. 100 to 125 is going to be what we would consider pre-diabetes, and then 126 or higher than that is diabetes. And this is usually a value that would be taken over a few different days, few different times, especially if you are somebody who's in that pre-diabetic or higher diabetes range. So they're not just going to immediately say, oh yeah, this person, he has 125, right, milligrams per deciliter on his blood glucose reading. So he has prediabetes. It very well likely could be happening. What they would do though is that would kind of just be a red flag, and we need to follow up on this and see what's really going on. And on top of that, once you kind of just know the general readings, some of the other things that you might actually notice from hyperglycemia, which is high blood sugar, that's just another name for it. And this is not an exhaustive list. This is a decent amount of things though. You might notice that you have some increased thirst. You might have a dry mouth, so you just feel like you need to almost quench that thirst with your dry mouth, of course. On the flip side, since you have increased thirst, you are also going to need to pee a lot. So you're going to have this constant need to feel like you're going to pee. Unexplained tiredness. So if you're not able to use that glucose in your bloodstream effectively, guess what? You're not going to have a lot of energy. This may lead to some unexplained tiredness as well. One of the other things that does happen with individuals with hyperglycemia is some vision changes as well. So this is a really interesting thing because a lot of people don't realize that when you have high blood sugar, this can damage your nerves. So for a lot of people, they'll get some nerve issues, specifically through their entire body, so maybe neuropathy, but on all of the nerves in your eyes too. So a lot of times when you get eye checks, they can actually see diabetes forming before it even happens. So just another good reason to make sure you get your eyes checked, even if you don't wear glasses like me. I'm a nerd, of course, but even if you don't wear glasses, it's still a good thing to go ahead and check on in. Unintentional weight loss or weight gain. So if you are not getting the proper glucose in your bloodstream, you might be losing weight very quickly, and you also could be gaining weight very quickly. Basically just unintentional fluctuations in your weight that you just can't explain. Frequent infections. So this is just something along the lines of your body's not able to use all of that energy to kind of help to fight off infections, and your body's just not able to use the energy very efficiently to do anything in your body. So if you think about it, your immune system is going to be highly compromised because of that. And some of the infections are a little more common than the others. I don't know particularly which ones off the top of my head. This isn't exactly in my scope, but just know that your immune system is going to be compromised a little bit. Another really interesting thing about this, and a fruity smelling breath. So this is something that I would say it's kind of subjective. Like I don't really know what a fruity smelling breath could be like. Of course, like I like bananas and I like apples, but I don't think it's just going to literally smell like bananas or apples, depending on what kind of fruit it is, but if you just notice kind of an unpleasant odor, just a different type of odor in your breath, it very well could be some of the symptoms of diabetes coming on. And this isn't to say that, you know, one day you pee a lot or you have unexplained tiredness one day, or maybe, you know, your vision is just a little off. This is not saying that you immediately have diabetes, right? These are just some common symptoms that if you have them reoccurring over a long period of time, it's probably a good idea maybe to talk to your doctor, or just go to the store and you can get one of those blood prick readings that will allow you to kind of see where your blood sugar is at. The interesting thing about both of these, or all of these different symptoms, is that they can be present in both type 1 and type 2 diabetes. There isn't really like a specific set of symptoms that would work for just type 1 or type 2. And type 1 is, of course, that genetic variation where the cells in your pancreas just simply aren't able to produce insulin. Type 2 is where you have so much blood sugar in your body that your body can't actually produce enough insulin to lower it. So in both of those different variations, it doesn't really matter when it comes to overall symptoms. So go ahead and like the video so far if you have learned something new from this and have gained a few actionable items on things to look out for when it comes to diabetes prevention.